Hello, my name is Samantha and this is Mr. King, and we're going to be conducting the musculoskeletal system assessment. First, I'm going to start by inspection and palpation of the musculoskeletal system. So I'm checking his body for alignment and symmetry. His extremities look symmetrical, his hips are symmetrical, he is standing erect, everything looks good. I also noticed his gait earlier, and it was even and it was steady. He didn't have any problems walking. Okay. Now I'm going to be checking his muscle characteristics. I'm checking for muscle spasms, masses, hypertrophy or atrophy of the muscles, and I do not see any. His muscles are firm, they're not hard, or they're not doughy, and I do not feel any crepitus in his joints at this time. Okay, next we're going to do active and passive range of motion along with checking muscle strength. So Mr. King, go ahead and please have a seat. Okay. And also his skin feels nice, warm, and dry. Alright, starting at the head and working our way down, we're going to start at the temporomandibular joint. Okay, Mr. King, I'm going to have you perform some exercises. Please let me know if you have any pain. Okay. So go ahead and open and close your mouth for me. Okay. I do not feel any popping or clicking sounds. I don't feel any crepitus. Okay, now go ahead and move your jaw side to side. Very good. Do you have any pain? No. And there's also no clicking or popping. And I'm going to have you move your jaw in and out for me. Good. And he was protruding his jaw, and once again I did not feel any popping or clicking. Next, I'm going to move down to the cervical spine. So I'm checking his neck muscles for symmetry. I'm also checking his folds to make sure that everything is aligned, and it looks good. I'm going to be checking range of motion. So Mr. King, I'm going to have you do forward flexion. I'm going to have you look down at your chest. Very good. And that was about 45 degrees. And I'm going to have you extend your neck. Very good. And that was at about 55 degrees. And Mr. King, I'm going to have you do lateral bending. So ear to shoulder. Very good. Ear to shoulder. Good. Any pain? No. And that was at about 40 degrees. And now we're going to do rotations. So I'll have them look left and look right. Good, and that was about at 70-75 degrees. So that's good. Now I'm going to test the strength of his sternonucleomastoid and trapeze muscles. I'm going to place my hands on your shoulder, and I'm going to have you push up against them. Very good. He does have really good muscle strength, and this is also checking cranial nerve 11 and his spinal accessories. Now I'm going to move down his back to the thoracic and lumbar spine, checking for alignment. I do not see any lordosis, any kyphosis, no scoliosis, so that's good. I'm going to be percussing and palpating his spine, looking for pain. So Mr. King, please let me know if you have any pain. No pain? Okay, very good. Now we're going to do range of motion for the thoracic and lumbar spine. So Mr. King, I'm going to have you please stand up. Okay. I'm going to have you forward bend. So please go down, touch your toes. Very good. Okay, and that was at about a 75 degree. Now I'm going to have him bend backwards and check for hyperextension. Very good. That was about at 30 degrees. Now we're going to do lateral bending. Good. Good. And that was about 35 degrees. Bilateral bending. And now we're going to do rotation. So just kind of rotate. Good. Any pain?
No.
He has really good range of motion in the thoracic and lumbar spine. Next, we're going to assess the lower back. So Mr. King, can I please have you lay on your back? On the bed. I'm going to be checking the L4, L5, and S1 nerve root endings. Mr. King, can I please have you raise one leg straight? Good. Any pain? No. Any other leg? Any pain?
No.
No. If Mr. King did experience pain during this procedure, it could mean that he had a herniated disc or that he had sciatic nerve injury. Mr. King, I'm going to have you go ahead and turn over on your belly. Very good. Now we're going to do the femoral stretch test, which I'm checking for L1, L2, L3, and L4 nerve endings. So Mr. King, go ahead. Very good. Now raise the other leg. Very good. Any pain in your lower back?
No.
No? Okay, good. So if he did have pain in his lower back, it could mean that he's having irritation. Alright, so now we're going to do the shoulders. So Mr. King, I'm going to have you please sit in this chair. Okay. I'm inspecting the shoulders and the contour of the shoulders. Once again, palpating the joint spaces. Okay, now we're going to test range of motion and muscle strength of the shoulders. So, Mr. King, once again, I'm going to be testing cranial nerve 11. Push up against my hand. Very good. Okay. Now I'm going to have you extend both arms behind your back. And this is checking for hyperextension of the shoulders. Okay, I'm going to apply pressure and I want you to push against me. And I'm checking muscle strength, and he has strong muscle strength. Now I'm going to have you lift both arms bilaterally and straight up over your head. This checks for abduction, and I'm going to add resistance. So push, good, and he is really good. And go ahead and push against me again. He has really good muscle strength. Okay, now I'm going to have him swing his arms across the front of his body, just one at a time. Now I'm going to add resistance, so go ahead and push. Very good. And the other arm, and go ahead and push. Very good. And adding resistance, he has very good muscle strength once again. I'm going to have him place his hands behind his hips, like so, with your elbows out. Good. And this is checking for internal rotation of the shoulder muscles. And I'm going to apply resistance. Go ahead and push. Okay, very good. Now I need you to place your arms behind your head with your elbows out. And this is checking external rotation of the shoulders. Okay, let me add resistance. Very good. He has strong resistance. And go ahead and push backwards. Very good. Thank you. Okay. Now for the shoulder assessment, I'm going to do the near test, which checks shoulder rotator cuff impingement or tear. I'm going to raise your arm up to 150 degrees and press on your shoulder. Do you feel any pain? Okay, other arm. And if you had pain, this could possibly mean inflammation or a tear. Alright, now we're going to do the Hawkins test. This is a shoulder rotator cuff impingement or tear. I'm going to abduct his shoulders to 90 degrees and flex his elbows at 90 degrees and internally rotate his arms to the limit. Okay. Okay. So let me have your arm. Do you have any pain? Mm-hmm. No? Have any pain? Mm-hmm. No? And if he had pain, this could mean inflammation or a tear in his rotator cuff. Any pain? Mm-hmm. Okay. Very good. Okay, now we're going to test the elbow for range of motion. I'm going to inspect the elbow as it is flexed, in the flexed and in the extended position. Go ahead and relax. Flex. In the extended position. Very good. I did not note any nodules on the elbows. I'm palpating the elbow and I'm finding where the old cranial process grooves. Okay. Now, Mr. King, I'm going to have you put your arms by your side and bend your arms at the elbows, making them go up and down. Good. Any pain? No? Okay. Now, I want you to bend your arms at the elbows like a robot and rotate your hands back and forth. Any pain? Discomfort? No? Okay. So he has good range of motion. Next, we're going to be checking, and as we were doing that, by the way, we were checking pronation and supination of the arms and the hands. Now we're going to be doing the wrist and hand. I'm going to be inspecting the dorsum and palm of the hands. Inspecting the dorsum and the palm of the hands for contour, position, and shape. Okay. And I'm also checking his fingers. We have all 10 fingers. Pardon my assessment. And I'm palpating each joint of the hand and the wrist. And now we're going to check rotation and muscle tone. Okay, Mr. King, I need you to bend your fingers forward, the metacarpal phalangeal joint. Okay, this is checking for flexion and hyperextension. Okay, now I need you to touch your thumb to each finger, to the base of your little finger. Okay, do you have any pain? Yeah, and he's able to do that very well. Okay, now I need for you to make a fist, and this is checking for finger flexion. And now I need for you to spread your fingers apart, then touch them together. Apart, then touch them together. And this is checking for finger abduction. Now I want to bend the hand at the wrist up and down. This is checking for wrist flexion and hyperextension. Now I need for him to put his palm side down and turn each to the right and the left. So, good. And we are checking radial and ulnar movement. Okay. Earlier I had Mr. King look at the cat's hand diagram, which is a diagram that kind of shows where the pain is. If he would have had pain in his fingers, I can see how it radiates, where it starts and where the pain and numbness and tingling is. But we are negative for that. Now we're going to do the thumb adduction test. And we're checking the medial nerve integrity. So go ahead and turn this way. Okay. I need you to turn your hands palm side up, and I'm going to apply pressure on your thumb. Any pain? No. He has full resistance, and that is normal. If he had carpal tunnel syndrome, the thumb would actually be weak. Okay. Next, we're going to test the tennal sign, which checks the medium nerve integrity. Once again, we're checking for carpal tunnel. I'm going to strike his wrist with my finger and ask him if he has any tingling. Any tingling? No. Okay, so he is negative for carpal tunnel. Next is the Flalan test, and this checks the median nerve integrity. I will need you to press the back of your hands together with your fingers pointed downwards. And he would be doing this for 1 minute. If he did have any numbness or tingling, that could mean that he has carpal tunnel. But we're not going to do it for the full 1 minute due to time. So now we're going to be doing the hip assessment. Adjust the camera a little bit. Okay, so Mr. King, I'm going to have you stand up for me. Okay. And I have already inspected the hips for symmetry at the level of the gluteal folds, and palpate the hips and pelvis. There's no instability, tenderness, or crepitus. We're going to test the range of motion and muscle strength of hips. I need you to go ahead and lay on your stomach, please. And lift your leg up while keeping your knees straight. Very good. And I know we did this earlier, but you didn't have any pain. Okay. Go ahead and turn over onto your back. And I want you to lift your knee while keeping it straight. Good. Any pain?
No.
Okay. Okay. And back up again, and I'm going to add resistant. Very good. And add resistant. Very good. Okay, he does have a really strong leg muscle whenever I was applying resistance. Now we're going to do adduction and abduction. I'm going to have you extend your leg to the side and then bring it towards your body. Side, and bring it. Okay, and I'm going to add resistance. Any pain, tenderness? No? Okay. And go ahead and do it to this side. No, any pain? No? Okay. Now we're going to do internal rotation 40 degrees. So I'm going to have you bend your knee and point your knee towards the opposite side of your body. So we're going to go towards the wall. And I'm going to add resistance. Very good. Okay. Now I want you to bend your knee and we're going to point it away from your body. So I'm going to go this way. And I'm going to add resistance. Any pain? No? Okay, we're going to do the same thing with the other one. We're going to do internal rotation towards me. And any pain? And external. Any pain? No. Okay. Now we're going to do the Thomas test, which checks for flexion or contracture of the hip. I'll have Mr. King lay on his back, which he is, and I need for him to lift each of his legs up to his chest and bend his knee. Okay. And as he's doing this, his hips are lying flat. He's not moving his hips off of the bed, which could mean that he did have a problem. Now we're going to do the Trendelenburg test, which checks for weak hip adductor muscles. I'm going to have you stand up for this test, Mr. King. Okay. Now I just want you to pick up one foot. Okay, go ahead and relax. And pick up the other foot. Very good. Okay, he did not lose his balance. I was checking for symmetry, which he had. The iliac crest did not drop on one side whenever he was picking up the other. If it had, that could mean that his muscles were weak, his abductor muscles were weak. Now we're going to do range of motion of the knee. So I'm going to have you go ahead and sit. I'm going to be inspecting the knee. Oops, sorry. I didn't mean to crush your foot. I'm going to be inspecting the knees for the natural concave areas and palpate the popliteal space and joint spaces. Okay. Now we're going to test range of motion by flexion. Go ahead and extend. Okay. Very good. It's about at 130 degrees. Good. Good. Very good. Okay. And now we're going to test the strength of the muscle with flexion and extension. So go ahead and put your knee out. Good. And what? And out. And down. Good. Now I'm going to push on the knee with the leg extended. So go ahead and extend. And I'm pushing down on his femur with one hand and pressing against his patella. If an effusion was present, there would be clicking or tapping in the knee where I'm pressing, which I do not feel. Okay. Now I'm going to be checking the bulge sign, which can mean that he has a collection of fluid above the knee. And I do not feel any. So I'm just kind of milking above the knee. Okay. Now we're going to be checking the anterior and posterior draw test. I'm going to have Mr. King lie supine. So go ahead and back on your back again. With his knees bent. And I'm going to press on each side of his legs. Very good. Very good. Very good. Very good. And His knees should move no more than 5 millimeters, which they didn't. So that was normal. Okay. Now for the McMurray test, I'm going to have him stay laying on his back. And I'm going to have him lift his leg up and extend the knee at 90 degrees. And then move his lower leg from side to side. And I'm listening or feeling for any popping or clicking. Okay. And if I did hear these sounds or feel any popping or clicking, I would suspect that the lateral meniscus is possibly torn. Okay, very good. Did you have any pain? No? Okay, next we're going to be doing the last test, which checks the anterior criticate ligament integrity. I'm going to have him stay laying on his back and flex the knees at 10 to 15 degrees, so just barely. And I'll hold his femur and pull his proximal tibia with the leg relaxed. Okay. And if I saw movement greater than 5 millimeters, I would then suspect an injury to a ligament. A little bit less. Okay. Next we're going to be testing the Vargas and valgus stress test. This checks for medial or lateral collateral ligament instability of the knee. Vargas is the abduction and valgus is the adduction. Mr. King will stay laying on his back, and I'm going to have him keep his legs straight. I'm going to stabilize the femur with one hand and push the ankle midline and internally by rotating the knee. Now I will pull the ankle and externally rotate the knee. Okay. And do it on this side. Now I'm going to have him do it, flex his knee at about 30 degrees. Okay, I'm not seeing any excessive medial or lateral movement. Do you have any pain? Yeah. Okay. Next we're going to be doing range of motion and muscle of the ankle and foot. I'm going to inspect his feet during weight bearing and non-weight bearing. I did do it during weight bearing as he was standing. He had good alignment. It didn't seem like there was any stress on his ankles. I'm going to palpate the Achilles tendon in each metatarsal. I know he's ticklish. And I'm going to have him do dorsiflexion. So Mr. King, there you go. And that's at about 30 degrees. Okay. I'm going to have him do plantiflexion, which is making his foot go flat like he's touching the gas pedal. And that's at about 45 degrees. Okay, I'm going to have him do inversion, so rotate your foot inward. Very good. And the other one. And that was about at 30 degrees. And try to leave your knee straight. There you go. And exversion. Good. That was about at 20 degrees. And then I'm going to have him do flexion of the toes. Okay. And then extension of the toes. So flexion and extension. Very good. And he was moving symmetrically. This has the strength of the muscles in his plantar flexion and dorsiflexion. Okay. Go ahead and push against my hand. Very good. And push against my hand. Very good. Alright, Mr. King. Now I'm going to measure his extremities to make sure that they are all symmetrical. And 35, good. And your arms too. Put your arms up, please. Very good. So his extremities bilaterally were symmetrical. I'm going to measure around his arm. Okay. Okay. And his calves. Very good. And for the most part, his muscles on bilateral upper and lower extremities were symmetrical. There was a couple centimeters different on either side. I believe with the functionality test that Mr. King can take care of himself and carry out activities of daily living as normal, as all of his muscles are strong and intact. Thank you. This concludes the musculoskeletal assessment.